Hello, my name is Danny Bega. I'm a neurologist at Northwestern University, and I'm the director of the Northwestern Huntington's Disease Center of Excellence. It's an honor to be here today to talk to you about Huntington's disease, a complementary and integrative approach. So these are my disclosures, and there are none that are relevant to this topic. So the objectives of today's talk are to introduce the topic of complementary and integrative medicine and its potential role in Huntington's disease, and to discuss the evidence and limitations of different complementary and integrative modalities in Huntington's disease. So just to start off with, I'm using a term here, complementary and integrative medicine. And this is what previously had been referred to as CAIM, or complementary and alternative medicine. I prefer the term integrative because the approaches I'm going to talk about are really meant to be used along with conventional treatment for Huntington's disease. And as I talk about how to integrate them into your day-to-day life and into your day-to-day practice, I'll discuss some of what we know in terms of the scientific evidence behind different complementary modalities and some of the limitations that we know about. I find that this is a topic that's not often covered in a lot of our more scientific focused meetings. And it is a topic that I think is very important and relevant to many of my patients and families that I see day to day who often have questions about this. I will give you sort of the warning that at the bottom line is that a lot of these modalities where there's a lot of interest, we don't have a lot of data. And unfortunately, there's not as much information available in the scientific literature as you would like. But I will share with you sort of the scope, the general scope of where the field is. And while many questions often come up about specific either natural therapies or other modalities, I won't be able to cover everything comprehensively, but my goal today is to give you an overview of the field. So just to start off with talking about Huntington's disease goals of treatment in general, is that unfortunately today there are no treatments that have been proven to slow, stop, or reverse the disease itself. Now there are a lot of active, really exciting studies in the field of Huntington's disease to try and find something neuroprotective. But today, the goals of our day-to-day management are to face the diagnosis and educate about the diagnosis, to provide genetic and psychosocial counseling, and to treat symptoms, to reduce the burden of both physical, cognitive, and psychiatric symptoms, and to maximize day-to-day function, and to improve quality of life as much as possible. And it takes a team. Most of us at Centers of Excellence treat people and families with HD with a multidisciplinary team approach to address these different issues. But where we fall short, where there are potential limitations to our conventional therapies is sometimes these treatments have an inadequate response. They're different from person to person. Some of our treatments have side effects, like any other treatment. And most of our treatments are symptomatic. Unfortunately, they're not yet disease modifying. And even with the symptomatic treatments, we find that some symptoms are more difficult to treat. Things like dementia or balance problems or irritability, even with our existing treatments, can be still difficult for patients day to day. So this leaves a gap where a lot of times patients and families are looking for other options besides the conventional care we have. And the National Institute of Health has defined complementary and alternative or integrative medicine as a diverse system of medical options, practices, products that are not presently considered part of conventional medicine, which really doesn't tell you anything other than that these are not part of our standard day-to-day care that you'll find in a typical clinic. So what are these modalities? Well, you can split them up into natural products like herbals, vitamins, minerals, mind-body practices like acupuncture, massage, yoga, relaxation, and alternative systems, which are completely different ways of looking at health, either traditional Chinese medicine or Ayurveda, homeopathy, different systems that are very different from the way we think about Western medicine. And so some examples of some of these specific modalities that fall under complementary and integrative medicine. Again, manual therapies. This may include massage or chiropractic manipulations. Mind-body focused interventions, which can include things like meditation, relaxation, yoga, prayer and spirituality, and psychotherapy. Biofeedback, which is where people can be hooked up to machines that can sense different physiological responses. For instance, if someone feels anxiety, they can be hooked up to machines where they can actually see their anxiety measured out physiologically and learn to gain control over certain symptoms. Complete different systems of thinking about health, like Chinese medicine, where as opposed to the typical philosophy in Western medicine, there are different elements and connections between the body and the earth and the world that are taken into account, and actually the whole view of how medicine is practiced is different. There's art, humor, and expressive therapies. This on the left is a picture of Patch Adams, who really felt strongly about the importance of humor and connecting to people as a way of healing. And then other forms of treatments like homeopathy, energy-related medicines like Reiki, naturopathies, and herbal medicines, and even cannabis would fall under this. So what are actually commonly used? If we look at the most commonly used approaches, natural products are by far the most common. And if you go to any aisle of a health store, even a CVS or a Walgreens, you'll find a lot of natural products that you may be wondering about. Deep breathing, yoga, Tai Chi, and Qigong, chiropractic manipulations. Those are among the most common. Meditation, massage, special diets, and lower down here you can see homeopathy, relaxation, guided imagery. This is just looking at some frequencies of how often these are used. But I just want to explain a little bit about the philosophy behind complementary and integrative medicine and sort of where this falls into day-to-day well-being. And so there's a few things that kind of bind all of these approaches together. And one is the idea of wellness. And so at the center, we're dealing with modalities that focus on managing disease by you as the patient, as the person dealing with the disease, being an active participant in your healthy lifestyle. That there's something to be gained by not just being a passive recipient of care, but actually being an active participant in your day-to-day life and in your health. The idea that self-healing is an important piece of these different modalities, that external manipulations, whether it be chiropractic, acupuncture, something that is done to you, can mobilize internal resources. The idea of bioenergy, that disruptions in the balance and flow of energy can cause illness. And this is different from typically how we think about Western medicine, but is a common theme among many complementary and integrative practices, is this idea of energy flow and how it can be manipulated to improve health. The importance of plants, that plants are a dominant part of nature in which we've evolved, and they're an important source of nutrients and medicines and energy. And lastly, but very importantly, the idea of individuality, which is focusing when we're treating someone on variation and not typology, meaning that everybody with Huntington's is not the same. That focusing that way would be considering Huntington's as a typology, that everybody is the same. But instead, we realize that everybody is unique, and every unique individual has unique inner resources that can be mobilized to improve their health. So these 5 elements represent a lot of the philosophy behind complementary and integrative medicine that we can try to bring into our approach to caring for people. So stepping back for a moment, what motivates people to go into some of these, to look into some of these interventions in their care? Some of it is just philosophical congruence, meaning some people just have a philosophical problem with some of what we do in Western medicine, and they desire a more holistic approach to healthcare, whether that's cultural or whether that's due to experiences with Western medicine. The idea of wanting a more holistic approach is something that motivates some people. For some people, it's about empowerment. It's about controlling your own illness. And again, this idea that you are an active participant in your healthcare can be important and empowering in feeling better and improving your quality of life. For some people, it's just having dissatisfaction with conventional healthcare that can lead to this. Sometimes it's things you read about in newspapers, in the media, on the news. And additional factors that have been studied that seem to predict more use, being female, younger, and having higher levels of education have all been associated with higher rates of use of complementary modalities, and having poorer health status. And whether that's because people with poor health status have more of a desperation and a need to try other things is not clear, but this seems to be associated with greater use of complementary modalities. In actuality, who's actually using it in this survey of people with neurological conditions, 44% of US adults with neurological conditions reported using some of these complementary modalities in the last year. And many used it along with conventional treatments. So not as a replacement for their general Huntington's care or their Parkinson's care or whatever the condition, but as a complement to it. And the use of complementary medicine is a booming industry. In 2000, about $14 billion per year was spent on these modalities in the US. And today it's closer to $40 billion per year out of pocket spent, oftentimes because these practices are not covered by insurance. As physicians, we often see some concern or discouraging patients from using these treatments. And some of the rationale there is as Western physicians, many of us are very focused on the scientific evidence. And I'll talk about how we can use scientific evidence to inform our use of these modalities. But most of these have not been well studied in well-designed trials. Most trials that are published so far have not been well powered, meaning they're often very small, often not generalizable to everybody who may be interested. And then things like internet testimonials are certainly not equivalent to science. And so there's a big discrepancy between what you can find on a Google search versus what you can find on a PubMed search, which is a search of the scientific journals. For some physicians, it's discomfort with just not knowing enough about these modalities because we're not really taught a lot about these in medical school. And then lastly, we're worried that people will pursue potentially costly or risky therapies that we don't know enough about. For instance, even herbal medicines, when we think about natural medicines, even natural medicines can be toxic or can have interactions. And we want to make sure that people are trying safe practices and that they're not spending excessive amounts of money on them. The result of this is that, unfortunately, patients often don't disclose their use of some of these modalities, which is not great for the relationship with your physician. At the same time, I usually tell physicians, absence of evidence does not mean absence of benefit. So not understanding how or why one of these modalities may work doesn't mean that it doesn't work. In general, unfortunately, there's just less funding also for this kind of research, which may be part of the reason that it's not studied as much. It does in studies of complementary medicine use, we do see that most patients are trying relatively safe and and low-cost therapies. And we may be underestimating the importance of these therapies in improving empowerment, reducing stress, and general healthy lifestyle on disease processes. So this is a study that I published a couple of years ago now, looking at all of the evidence available in the scientific journals behind different modalities for Huntington's disease. And what you can see here is when we looked at alternative medical systems, mind-body interventions, and natural therapies and supplements. And this is the full table of what we found as evidence-based or higher quality studies looking at these modalities. And there's not a lot. You can see here the first column of number of RCTs, which is number of randomized control trials. These are the higher levels, the better kind of trials that lead to our being convinced that something works. There's not a lot. There's one on traditional Chinese medicine. There's a handful on dance therapy, music therapy, different exercise modalities. And then in terms of natural supplements and nutraceuticals, you can see a handful here on things like cannabinoids, coenzyme Q10, creatine, different ones listed here. And they're not all positive studies. And so let's dive in a little bit into what we know. Starting with nutraceuticals, I'm going to just give you a overall picture of unfortunately, a disappointing area of science and study. So many people ask about this. Is there something I can take, something over the counter, something natural, something I've seen on an infomercial? And the bottom line is we don't have anything evidence-based or proven to be effective in people with HD that slows down or stops the disease. And the reason this is particularly disappointing is that in animal studies, some of these compounds have been positive. We have seen that when we look at the idea of protecting cells in the brain, protecting neurons from degeneration, that sometimes healthy compounds that are antioxidants that can protect cells from unstable molecules that damage them in animal models can slow down disease progression. But when these have been studied in humans, we've not seen similar success. And some examples are shown here with coenzyme Q10 and creatine, vitamin E, idebenone. These are all antioxidants that in animal models have shown some promise in slowing down progression. But when we're studied in humans, for instance, in large trials of coenzyme Q10 and creatine, were stopped for futility because they were not seen to be more effective than a placebo or a sugar pill. Ethyl EPA is something that's found in, for instance, omega-3 fatty acids. And again, a study here was negative in terms of not seeing benefit in people. And so these were all disappointing outcomes from some of the more commonly studied natural therapies or antioxidant therapies. So what can you do in terms of diet and nutrition? Well, high-calorie diets we know are often important in people with Huntington's. The metabolic rate is faster in Huntington's, and there's often a weight loss that concerns us. And so this does need to be individualized. Ketogenic diets are not well studied in Huntington's yet. Mediterranean diets have been studied because they're high in antioxidants. And the idea, again, being protecting cells in the brain, we may want to be high in antioxidants. But one study was not shown to be effective. Similarly, though, in that study, they were not expecting to see this, but high-fat dairy in the diet was associated with a faster progression. So it seems like maybe from this one study that diets that are high-fat dairy can be worse for people with Huntington's. The idea of having a healthy, high antioxidant diet makes sense, but we haven't been able to prove that that works in people. Green tea extract has been studied in animal models, and mostly lab data has been shown to be potentially helpful for preventing mutant Huntington proteins from building up, but more data is needed in people. And so the bottom line is that you should really see a nutritionist or a dietitian to recommend a high-calorie diet specific for you. The HDSA also has some suggestions and recipes for people on their website and in pamphlets, and in our clinics often we can give advice on this on an individual basis. I often tell my patients, not evidence-based, but I recommend a healthy, high-calorie, but high antioxidant diet because theoretically that may help, but we don't have evidence for that. I often get a question about cannabis. So switching still with sort of natural therapies, but talking about one that is becoming increasingly common is cannabis. And is it something that people with Huntington's should be using? Well, the history of cannabis as medicine, it goes back pretty far to the, probably longer than this, but at least in the early 1800s, a physician brought this from India to the Western world. It was being used, Queen Victoria was using it to treat her menstrual cramps. There was use of this early on as an analgesic, meaning a pain medication, a sedative, an anti-inflammatory, an antispasmodic for muscles, and even an anticonvulsant. Cannabis is complicated. It's a very complicated compound. It contains over 400 different chemicals. The THC is the main psychoactive chemical. The CBD also important in impacting the way the THC works, and by itself also has some sedative properties. Terpenoids are what give it its unique smell. Flavonoids give it antioxidant properties, which I already mentioned. We think antioxidants may be beneficial for the brain, and there are these natural antioxidants that are part of cannabis products. And we all have natural forms, or what we call endogenous forms of cannabinoids that our bodies naturally make. And so we have receptors for cannabis or cannabinoids in our brains. So CB receptors are the natural cannabinoid receptors that we all have in our brains. And in this orange slice here, this is a rat brain. And you can see in orange here are all the areas lit up of where this rat has cannabinoid receptors. It's very similar to a human. The balance area of the brain in the back is covered in cannabinoid receptors. And the deep part of the brain, which controls movement, or the basal ganglia, is covered in cannabinoid receptors. But they're also spread throughout the brain. And what we find is this distribution is similar in humans. What we also find is that there's a loss of these cannabinoid receptors over time with Huntington's disease. And that actually one study showed that the loss of cannabinoid receptors correlates with more mutant Huntington protein. So as you get more mutant Huntington protein, you get less of these cannabinoid receptors in the brain. So we naturally use these receptors for cannabinoids that we all make to improve our immune system and reduce inflammation, to improve our appetite and our immune function, to improve pain. And so the strongest evidence outside of Huntington's is for improvement for nausea, for appetite, and for pain. But now that we know that these receptors are lost over time in Huntington's disease, there's a question about whether binding to these receptors may alleviate some of the excessive movements that people with Huntington suffer from, called chorea, or these hyperkinetic movements. Could it be that losing some of these receptors is part of the reason that you get too much movement? So some studies have looked at this in Huntington's disease. And unfortunately, you're seeing only 4 studies shown here. And these are the best studies that we have to point to. There are not many, and the numbers are small. One of them was a 15-person study. One of them was a 37-person study. And the others were just 1-person case studies. So really small. What you can see from this is some of these were synthetic forms of cannabis. But the bottom line was one of them showed no effects on chorea, on the abnormal movements, by binding to these cannabis receptors. One of them did show reduction in chorea. Another one showed improvement in motor scores, coordination, and chorea. And then another one of a 1-person study actually showed worsening of chorea. So based on this, it's insufficient. We can't make a conclusion on whether this helps or whether this improves movements. The evidence at this time is inconclusive. There are some potential risks with regard to cognitive and psychiatric complications we have to think about. And I think more research is really needed and is happening. Certainly for palliative purposes, meaning for people who are suffering from pain, from appetite issues, it has better evidence than specifically for movements. Theoretically, there could be some negative effects. Driving is already a problem for many people with Huntington's, and so certainly driving under the influence of something like cannabinoid could be a problem. It could affect things like reaction time and attention. We know that there could be some potential respiratory issues from long-term use. But psychiatric issues are also common in Huntington's. And so could there be problems with anxiety or panic? We know that this is something that some people experience with cannabinoids. Problems with motivation can be an issue, and apathy is already a problem in Huntington's. And then cognitive issues. People with Huntington's develop dementia, and there are potential negative consequences to cannabis on cognition. This is a study that was done a little bit more recently looking at a spray of a cannabis product compared to placebo. And this was an oral spray. And it was looked at 12 people in one group, 13 people in the other group, and then they switched. So the group that started on the cannabis product switched to placebo, and the group that started on placebo switched to the cannabis product. And here they didn't see any difference in safety between the placebo and the drug. They also didn't see any difference in motor benefits between the placebo and the drug over this period of time. So there was really no difference. You couldn't really tell who was getting the drug first and the placebo second, or who was getting the placebo first and the drug second in this study. Even without knowing too much more about the safety and the benefits, it's also complicated to use this and to recommend it because we don't really know how to dose it. As physicians, at least, we don't know how much someone might need. There are differences between the sativa strain and the indica strain in terms of their effects. There's also all different kinds of products that may all have different effects, different concentrations of THC versus CBD. A lot of this is self-determined, which makes it difficult for us to sort of recommend specific ways of using it. When physicians are asked about where they get their knowledge about cannabis from, some of it is the medical literature, but a lot of it is just what's out there in the media, what we learn from other physicians, even what we learn from personal experience. So this isn't the best way to learn or recommend things to patients. We think, this is what physicians think from a survey that we took, that specifically it may help with nausea and anxiety and pain, but for movements like tremors or dyskinesias or chorea, it's unclear. There's a mix in terms of whether physicians think it may or may not help. So basically what that tells you is we are uncertain ourselves about whether this is good as a whole, as a population. When movement disorders neurologists were surveyed, they said that they think that maybe it would help with appetite and pain and nausea, but they were concerned that it might worsen things like fatigue and motivation and forgetfulness and hallucinations. So there were some potential positives, potential negatives, just theoretically. So my bottom line on cannabis is I think there's a lack of consensus among providers regarding whether it's effective and also what is the scope of the potential negative effects. I think this lack of consensus reflects a lack of knowledge, because only about less than a third of doctors are really get any formal education about cannabis products. And so this underscores the urgent need for widespread education and more research to be done, specifically in Huntington's, on this. We know that there's potential. I mean, cannabis receptors are widespread in the brain, but that also means that there's potential for negative effects because cannabis receptors are widespread in the brain. There are legitimate palliative uses for appetite and pain, but non-palliative uses we're unsure about. And so the jury is still out on specific effects on specific movements, for instance. The AAN, or the American Academy of Neurology, has put out the guideline that there's insufficient data at this point to support or refute the use of oral cannabinoids in people with Huntington's disease. All right, I'm going to switch gears briefly to talk about alternative medical systems. Unfortunately, there's not a lot of evidence to discuss here, and that's why I'm going to talk about it briefly. Looking at alternative medical systems, we're really talking about completely different philosophies of health. These may be philosophies that come from Eastern medicine, like Chinese medicine, or Indian medicine, like Ayurveda. They have different ways of thinking about the body, of the way energy may impact health. In this case, showing the 5 elements in Chinese medicine, focusing on how different organs may be reflected by different elements in the world, and how our bodies connect to nature, and how that can be used to address health. Only one study had, and it was only of 4 patients, showed improvement in chorea, and this was in a Chinese herb. YGS is the name of the herb, and it was shown to improve movement in these 4 patients, and improved chorea scores in these patients. There have been no similarly well-designed studies in Ayurveda, in Tai Chi. The prevalence of Huntington's disease is lower in Asia, and that can be part of the reason for this, but I think we just need more well-designed studies of these systems in general. And because the philosophies are different from Western medicine, sometimes the criteria by which they do their studies are not the same as the criteria we look for when we're assessing the evidence of studies in Western medicine. One last thing I'll say about alternative systems is, if you're interested in looking into alternative systems, find people who are well licensed, ideally people who are also working or collaborating with people in academic centers, but certainly people who are licensed by bodies who govern over them. So lastly, I'm going to talk about exercise and mind-body interventions. This is something I'm particularly interested in. First of all, I think exercise has a lot of benefits for people with and without Huntington's disease, but exercise reduces fatigue, which is a common complaint for people with Huntington's. Apathy is a common complaint for people with Huntington's, and it's something that exercise can help with. It can reduce depression and improve mood because it releases natural endorphins. It improves your overall health, but it also can reduce inflammation and improve immune function in the body. And again, if we look at the level of a particular neuron in the brain, we want to reduce inflammation because we think that can be a part of the reason that cells deteriorate. Some exercise modalities have social interaction as an important piece. It can promote levels of independence, and importantly, it can reduce falls and improve balance. So the bottom line of all of these things is that it can improve quality of life. And so why does that matter in a genetic disease? You may say, look, I have a gene that causes Huntington, so what's the purpose of exercising if my DNA is programmed to cause this disease? I can't fix that with exercise. Well, one thing we know is that if someone has, let's say, 45 CAG repeats as the cause of their Huntington's disease, we also know that we don't know the exact age of onset for that person or how quickly their disease will progress. And 2 people with 45 CAG repeats may present at a different age and may have a faster or slower progression than one another. So what that means is that gene mutation alone does not define how soon someone gets the disease, how quickly that disease progresses. So there have to be other factors. And some of those other factors we're learning are genetic. There are other genetic markers outside of the Huntington's gene that can predict earlier or later onset. But there's also a question about whether other environmental factors may predict earlier or later onset. Things that affect stresses in our life, potentially exercise and mobility, other factors socially that may predict earlier or later onset that we might want to tap into. So exercise in animal models of Huntington's has been shown to improve cognition, to delay onset of motor symptoms, to raise level of natural growth factors that our brain makes. So this came out of treadmill exercise with rats that are given Huntington's disease, mice that are given an environment that's more of like a playground to be in versus mice that are sedentary and just fed, seem to have, those who are more active seem to have better overall health and progression of disease compared to those who are more sedentary. And in people, so the question is, what does that have to do with people? Is there evidence that exercise can actually slow down or impact the course of disease in people? Well, this is an observational study of people from Australia and New Zealand, 154 people, showing that those who are the most passive have an earlier onset compared to those who are more active. So if you look at age of onset of Huntington's symptoms, those who are more passive have the earlier age of onset. Those who are less passive have a later age of onset. This is a correlation, so we can't prove that one causes the other. It could be that there's something before developing symptoms that makes people want to be less active. But in general, about 4 to 5 years later onset for those who are more active. There's also evidence that exercise in people, for instance, cycling or even resistance exercise twice a week compared to just general care can improve walking and even cognitive outcomes. So it's physical and it's non-physical in terms of the potential benefits. There was a study of 25 people who did a home exercise DVD. They did this 3 times a week compared to just regular care, and they saw improvement in gait speed and balance compared to people who were just getting standard care. And multidisciplinary rehab programs, which incorporate exercise, as well as speech and physical therapy and cognitive therapies, have been shown to improve motor function and improve day-to-day life. And so there's a role for these comprehensive rehabilitation programs in improving the course of someone with Huntington's disease. And it doesn't have to be conventional gym exercise. I think just being active is important. You can think outside the box. Recumbent biking, golfing, there can be a lot of ways to stay active. Even there have been studies in people with movement disorders on using the Wii Fit, so a video game, to improve things like mood and quality of life and balance. One of our groups here, the Shirley Ryan Ability Lab, which is our rehab hospital here in Chicago, they did a study on video gameplay, Dance Dance Revolution, in people with Huntington's disease. And they were able to show that 45 minutes twice a week for 6 weeks of Dance Dance Revolution was able to improve gait and balance measures in people with Huntington's disease. So really get creative with this. And so I'm going to go back to, I kind of gave you an overview. I focused specifically on, when I talked about the natural products, the alternative systems, and the mind-body interventions, I focused on the things where we have studies to back it up. But I want to come back to this sort of the theory here of what is the basis behind that these all share in common. And so in the end, what we're talking about is being physically active, being mentally active, eating healthy, sleeping well, stress management, all of these things that you can do yourself that can really impact the course of your disease outside of the medications that we give you. And that's why this is complementary and integrative with your care that you're routinely getting. Just to hammer that down, alternative things that can affect your mind and body that can be helpful: dance, gardening, arts and craft activities. I mean, there's evidence behind some of this, at least observational evidence. And so this is showing you that if we look at people over time, this is not specific to Huntington's disease, but all people, that those who do more activities have better cognitive function later in life. So computer activity, craft activities, social activities, reading, all of these things were associated with less risk of getting cognitive problems later in life. Good sleep is key. When you don't have good sleep, physically you don't function well, mentally you don't function well. And insomnia is a big problem for people with Huntington's. It could be because of the chorea. It could be because of sometimes lack of daytime stimulation. It could be because of depression, or sometimes just the sleep-wake cycle is deteriorating. We can use medications to help with the chorea, but a lot of it is also behavioral. Getting regular exercise can help your sleep. Relaxation can help your sleep. Having a regular schedule or regular time in bed and out of bed can help your sleep. Trying not to eat right before bed. Keeping the room dark and quiet and well ventilated and comfortable at night. having kind of bedtime rituals, and using your bedroom mainly for sleep. All of these things can help with your sleep, and that can in turn help your day-to-day function. And stress reduction. So first of all, this is for patients and families, allowing extra time for tasks, avoiding putting extra pressure on tasks, allowing time to respond to questions, reducing distractions when you're doing something, using shorter sentences when communicating with someone who's dealing with cognitive issues, and understanding that insight into the disease is not always fully achievable, but sort of not demanding excessively. Having regular schedules and routines, incorporating a lot of the things I mentioned into day-to-day schedules, having your hour for art and craft activities, having your hour for physical exercise, having set schedules like that will help you cognitively, will help with your sleep, and it will help your overall disease course. And so incorporating this in stress reduction is another way of kind of integrating that into your day-to-day life. And so I'm going to end here with just a few overarching kind of summary comments, which is that the goal of Huntington's treatment is to optimize quality of life and maximize function. That's the goal today. I'm very hopeful that the goal in the future is going to be to slow down and stop the disease. And there's a lot of great work happening in that regard. But today, we want to optimize quality of life and do everything we can to improve function. Complementary and integrative medicine modalities may have a role in Huntington's, although good studies that minimize bias and that prove clear cause and effect are lacking. Those are the kinds of randomized control studies we like to see. There's no convincing evidence for any specific dietary or nutraceutical supplement that you can get over the counter. Exercise, dance, and mind-body interventions are safe and may have benefits. Given the amount of money spent on these modalities in the US, more funding for research in Huntington's is really needed. You definitely want to discuss with your doctor all non-prescribed treatments that you're using, over the counters, other modalities that you're involved in. Be cautious of practitioners that offer miracle cures or invasive procedures. Be careful what you read on the internet and what you see in the news. The best thing is to discuss with your neurologist first. Hopefully they'll be open-minded about it. Exercise is important at all stages of the disease and really needs to be tailored to your particular ability and your particular stage of disease. So you want to work with your neurologist and your multidisciplinary team, your rehab team on these elements of exercise. Healthy lifestyle, which involves paying attention to nutrition, to sleep, to stress management. This really has an impact on your overall disease, and it empowers you to take control over your disease course in addition to the medications that you may be receiving. And so the emphasis is on complementary and integrative rather than alternative to conventional management. I think this is the best way to approach it. And with that, I want to thank you for your time and attention. It's been a pleasure talking to you. Thank you. Hello, everyone. Good morning. Thank you for your attention. I only have a few minutes left. I realized my talk went a little bit longer than it was supposed to, but I'm getting a lot of questions in here, which are really good. So I'm just going to run through them as quickly as I can. One question was about cannabis and about where trials might be going on or if I'm conducting any trials. Unfortunately, I'm not personally doing any clinical trials of cannabis in HD right now. There are groups who are good at doing these trials. I looked at clinicaltrials.gov and HD Trial Finder, and unfortunately, I didn't see any actively recruiting trials right now. A group in Spain just completed a trial in HD. And then there's a group in Colorado who's been really good and thoughtful about doing cannabis research in movement disorders. But unfortunately, I'm not aware of any active trials right now. Someone had mentioned something that I learned about at this meeting about vitamins B1 and B7 as potentially being helpful for function in the basal ganglia. And just wanted to highlight that there was a talk actually at this meeting this year about that looking at animal data. Unfortunately, we don't have human data on vitamin B1 and B7 yet, but it sounds like there's some promising basic science work that's being done that might lead to human studies in the near future. I'm cautiously optimistic when I see this, only because I mentioned studies before about things like coenzyme Q10 and creatine, where we also had positive animal data, but human studies, unfortunately, were unsuccessful. But I look forward to seeing more about particularly these vitamins B1 and B7 that were discussed at this meeting. One question was about over-the-counters that you might see, or practitioners that might offer alternative therapies and how to find them. And in general, I really do encourage you to check with you need to have a good relationship with your neurologist, with your treating team. You need to be able to be open with them. And if you feel like you're working with someone who is not open to hearing of your interests and taking your questions thoughtfully, I think you do want to question whether that's the right fit for you. Not that you should be dictating your care, but that you should feel comfortable with bringing up your concerns, your interests, your questions to your doctor. And your doctor should at minimum be willing to hear your questions and to guide you into finding the right answers. Even if they themselves don't know about a particular product or modality, they should be willing to look it up, to give you some information in terms of approaching these thoughtfully. Because when it comes to natural therapies, you do want to be asking your doctor about any potential interactions, any potential risks associated with them. And when you go to licensed, when you want to go to other practitioners, you want to make sure that they're licensed by, for instance, there's a national certification for acupuncture and oriental medicine. I mentioned ideally if they're affiliated with academic institutions, that can be helpful, because then they can collaborate with your team, and they may be more academically inclined in terms of their decision making. It looks like I'm already over. I think that really did, though, summarize most of the questions that were asked. So I'm happy to take any other questions offline through email or any other way. But I really appreciate your time and your attention. Thank you.